What is the best way to avoid surgery if you have already injured your knee?
That actually is a workshop, not a quick answer. However, the rule is the same, which is we have to open and strengthen the muscles that surround your knee joint. So straighten out your leg, any leg, yeah, there you go. So right here you got the tibialis. This has to be both lengthened in virasana and strengthened by doing flexion of the ankle. Then there's the quadriceps, which has to be opened by doing supta virasana and strengthened by doing standing poses and contractions. Then there's the gastrocnemius, which has to be opened by doing Adho Mukha Svanasana and strengthened by doing the opposite, by the pointing actions that we do in the opening series. Then you've got the hamstrings, which have to be opened in Supta Padangushthasana and strengthened in Shalabhasana, which is part of the Surya Namaskar. So by doing these 4 major muscles and then the lateral muscles, the tensor fasciae latae and the IT band, which is responsible for a lot of knee pain from injuries, and then the adductors. So if you look at it from a healing standpoint for an existing injury, it would have to be the hip series. Doing the hip series every day will slowly and steadily unwind the tension around the hips, which will then make its way down into the knees. So talk to your Purna Yoga teacher and learn the hip series and start practicing it. The simple thing you can start with today is Supta Padangushthasana. So let's just do that for a moment. Lie on your back. Take your right leg up. This is number 1 of the 6-part hip series. One of the more important asana for our modern society, because it helps the sacroiliac joint, it helps the lower back, it helps with the hips, and of course it helps with the knees. So breathe in this for a few, maybe 9 breaths, and then change sides. So again, this is number 1 of the 6-part hip series. Remember, this is opening the back of the leg, where a lot of tension prevents the knee joint from straightening and thereby causes injury when it needs to be straight. And when you're reaching for something and the knee won't straighten because there's too much tension in the muscles and tendons, then it goes into the joint itself. And slowly release. Take your time, bend and roll over. Namaste.